When we talk about fillers, they're basically collagen was the earliest and only filler on the market for many years. This was followed by the release of Restylane a few years ago, and now the release of Juvederm. Juvederm and Restylane are both hyaluronic acid, and they last similar amounts of time, although Juvederm at this point seems like it's lasting longer, and I have now used mostly Juvederm as a filler. The most recent product to enter that market is a product called Artifil. Artifil is a permanent filler. It is a plexiglass or methylmethacrylate spun down to a fine powder and put inside collagen. You can inject the collagen, you see the immediate effects of the collagen, and then as the collagen goes away, these little fine beads form their own little collagen around them. It's a great product. The best part about it is it's permanent. So if the first time you get an injection you get 30, 40, 50% correction of that crease or that wrinkle or that fold, wherever we're putting it, that a year later you still have that correction, you can sort of add to it. As we get older, our faces tend to become more hollow. So now having a permanent filler which we can take off the shelf has been a huge boom to the market, and I think will really find its place over the next 6 to 12 months. Sculptra is a filler that is microspheres of an absorbable suture material, and Sculptra is a great volumizer for the face. So in patients who have developed hollowing, which everyone gets with aging, you can use Sculptra and fill in a whole area to the cheek. The advantage of Sculptra is the thinness of it, and the fact that we mix it. So Sculptra we get as this powder, we mix it with a solution of water and a little bit of lidocaine, and then we use that water and lidocaine as a carrier to sort of scatter those little bits of suture material out underneath the skin to add volume to that area. When you're injecting it, the patient gets an immediate sense of what they're going to look like because we've injected this volume of water, and they say, oh, I like the way that looks. Of course, they reabsorb all that fluid we injected, and then the volume from the Sculptra will build over the course of 4 to 6 weeks. Minimal downtime because it just involves some injections. The only question that patients have, and it's really hard to answer, is how long is it going to last? In some patients I've had it last as long as 3 years, 4 years, and still lasting. And other patients I think I've seen it getting reabsorbed at a year, 15 months. Some of that is volume related. Obviously the more that's put in, the longer it lasts and the better the patient looks.